Well, navigating healthcare coverage and insurance benefits in today's marketplace can be a complicated and pricey task for many Americans. So, joining me now to talk about how his company is helping people make more informed decisions when seeking out treatment is Kevin Chew. He's a co-founder and CEO of Certainly Health. Kevin, welcome.
Thanks for having me, Kristen.
How is your company trying to make this process easier and more affordable for patients?
Yeah, so Certainly Health is a marketplace for booking doctors with upfront prices and avoiding surprise bills. So patients enter their insurance and visit reason, and we use machine learning to predict and guarantee their out-of-pocket costs for every provider. And so we were unlocked by the 2022 transparency and coverage rule that went into effect and required insurance companies to publish prices for the first time. And using that data, we're making it possible for patients to pull up their phone, enter their insurance, and see exactly how much it costs to book different doctors, starting with shoppable services, which is anything that you can schedule in advance. So no emergency care or complex surgeries yet.
And if a patient wants to use this, is it free for them to use, or
Yes.
do they pay to use Certainly?
No, it's free for all patients to use.
What's the business model for your company?
Yeah, so every time we send a patient to a provider, they'll send, similar to ZocDoc, they'll pay us a fixed booking fee.
Interesting. Now, in terms of how much on average you can save a patient, how would you quantify that?
Yeah, so it obviously depends on your cause or your visit reason, but it's hundreds of dollars to sometimes thousands of dollars, depending on what it is.
Certainly, information these days is so sacred, right? Especially in the age of artificial intelligence, the internet as well. United Healthcare, actually the largest health insurer, recently seen a massive cyber attack. How do you ensure that patients' data is safe on your platform?
Yeah, of course. We're obviously following all HIPAA related regulations when it comes to storing data securely and encrypted, and ensuring that there are proper access controls in place. And so any patient who enters their insurance can be assured that it's being stored safely and securely.
And this is live now.
This is live in New York City now, yes.
And plans to expand beyond New York City?
Yeah, absolutely. I think we're starting in New York City because that's where we were founded, and we do plan on expanding nationwide soon.
And what's it going to take to get that expansion?
I think once we prove out the business in New York City and really have a critical mass of people using our platform, then we'll be able to expand quickly, especially because the price transparency data was national, not just in New York State. So it becomes easier to expand.
How do you measure that success that you want to see in New York to take elsewhere?
Yeah, of course. I think it's baseline business numbers, so revenue, user growth, traction, just the standard retention, things that I think any marketplace needs in order to grow.
And so what are those goals that you want to hit, those numbers, those metrics that you want to hit in order to take it elsewhere?
Yeah, of course. I think without getting into specifics, probably in the several millions in revenue, as well as tens of thousands of users and bookings per year.
What's the customer acquisition strategy?
Yeah, in terms of acquiring customers, there are a few ways. One is through viral social media platforms where there's this huge problem that almost every American has faced when it comes to surprise bills. And so we believe that we're building something that's super resonates with Americans and the desire to avoid surprise bills. So that's one. And just sharing that actually prices can vary by hundreds of dollars across healthcare providers with no difference in quality, and being able to use Certainly to be able to find the provider that's most affordable and best fit for your needs.
Tell me about how the conversations have been going with some of these providers and whether or not every provider is open to providing this sort of information to your platform.
Yeah, I think the amazing thing is that due to the regulation that I mentioned earlier, transparency and coverage rule, all the insurance companies had to publish these prices. And so there isn't necessarily a buy-in from the providers to provide their prices, but actually we're able to bootstrap the supply side of our marketplace using that publicly available data, as well as deploying machine learning and AI models to predict the out-of-pocket costs for each patient's specific insurance.
Interesting. And what goes into those AI models?
Yeah, of course. So we're using AI to train on claims data for two things. One is, as a patient, you generally don't know what you're going to end up getting treated for during your visit. And so using that claims data, we're able to predict and show the list of potential treatment paths that you may end up getting treated for during your visit and how much they'll end up costing. Then the second part is for every patient-specific insurance, there can be variance on what their out-of-pocket costs will be. So for example, some insurances only cover certain procedures and not others. The copay might cover some procedures, not others. The diagnosis can change the amount that the patient owes. And these are all things that we're using the claims that we process to apply those learnings to similar procedures, plans, payers, and providers to create the most accurate platform for predicting out-of-pocket costs.
So to what extent do you work with insurance companies out there to get those claims?
Yeah, I mean, the claims data is something that you do have to pay to access, but because we're processing bookings through our platform, we're able to access and use the claims that are booked on our platform.
Are the claims attached to names?
They are, yes, because of the people who book through our platform.
Interesting. So in terms of what the claims data tells you, what is the takeaway from that?
I think that you'll find that the prices can vary tremendously across providers, and there really isn't a difference in quality. But at the same time, the most expensive one, like tidbit, for example, is that hospitals and health systems tend to be much more expensive than private practitioners. So that's one interesting tidbit that you can find from the data.
I think that is a really good takeaway. I think a lot of people don't realize that sometimes if they do book kind of a generic appointment at a hospital, that is. But just to be clear, you said you pay for the claims data. Where does that claims data come from?
Yeah, there are brokers that offer the claims data, and it's all de-anonymized. So there's no PHI to identify any individual. When I mentioned the individuals, I was talking about the people who are booking through our platform specifically and have already volunteered their information to us.
You want to expand to new geographic regions? What are some other opportunities for growth?
Yeah, absolutely. So I think one really exciting opportunity for us is being able to expand to cosmetic procedures where there's also a similar price variance. For example, Botox and fillers and other procedures.
All right, Kevin Chew. Join us again when you figure out how to crack that Botox market.
Awesome.
Kevin is the co-founder and CEO of Certainly Health. Kevin, thank you.
All right, thanks so much, Kristen.